one of the best ways to relieve stress and tension from the neck and shoulders is not a stretch. It's a passive exercise called the supported bridge. For this, you'll need 2 yoga blocks and a towel, or a yoga bolster, or a foam roller. By the way, I'm Dr. Russ. I practice in Portland, Oregon. I do lots and lots of myofascial work. I've been in practice for 27 years, and probably neck and shoulder tension is the #1 thing that I see. So I'm glad you're here. Thanks for watching. I appreciate you doing this with me. As always, I appreciate your views, your likes, your subscribes. Share this with friends and family. I appreciate your support of my channel. Let's get into it. For our purposes today, I will show the use of 2 yoga blocks and a towel, because I think probably more people have these than foam rollers or yoga bolsters. But if you have a foam roller or a yoga bolster, please use that. So we're going to put our yoga blocks and towel down on the floor or mat with enough space for your lower body to stretch out on one end and enough space around you for you to move your arms. And we want to lie down face up so that our head is on the yoga block or bolster and our pelvis is off. If your foam roller is really long, like this one, compared to my body, right? My tailbone, my pelvis would be on the foam roller. But it's nice also to have your sacrum in contact and connected to the floor or the mat. And all we're going to do is lie on it. So let's get that done. Get yourself situated so that as you lie on it, kind of the upper part of your lower back is supported by your prop and your head is supported by your prop. So that's what this looks like for me. You can see my hips are in contact with the mat and I've got room to move my arms. So basically, our exercise today is to relax and get comfortable in this position. For some people, this is hard on the lower back. The lower back is not flexible enough to allow the hips to comfortably rest on the floor. If that's the case, we're going to prop our hips up with a pillow. Just a plain old simple pillow, nothing fancy. Some days you might need it, some days you might not. That's how bodies are. Today this feels good to me, nice and propped up, so I can really relax into the support for my upper body. So get yourself propped up, nice and comfortable. Bring your hands up over your head, out to the side and down, and circle again. Feeling the shoulder blades starting to move on the upper back, on the rib cage. Feeling the collarbones moving too. I will link in the video description to a video of me talking you through feeling, sensing, and getting motion into your shoulder blades and collarbones. That's not a prerequisite for this, but these two go together pretty nicely. So in this position, your shoulder blades are off of the prop and gravity is pulling them toward the floor. Think about your shoulder blades being triangular plates being pulled to the floor just by gravity, and it's going to sag slowly. These tissues take time to deform and the muscles take time to relax. And what muscles you need to relax in order to let this happen is in the chest. The outer layer of those pectoral muscles, the inner layer of the serratus anterior, that's those finger-like muscles that wrap around the rib cage, and then the deepest layer of the intercostal muscles, the muscles between the ribs. As all of those relax under this gentle, sustained stretch under gravity, then your shoulder blades can gently sink toward the floor. They're not going to touch the floor. That's not our goal. Our goal here is to relax and open the front body from the solar plexus to the airway. With that in mind, we're going to do some deep breathing, directing your breath into the front. And with the pressure of your prop on your back, it's a little easier to allow the breath to come into the front, into the chest. Think about your chest rising toward the ceiling, and also imagine it opening like a book to the ceiling. With every in-breath, it rises and widens, and the out-breath is an opportunity to totally relax. There's no need to press the air out. There's no need to compress or contract your abdomen in order to push the air out of your lungs. The natural elasticity of your diaphragm, your rib cage, and your lung tissue will expel the air completely on its own. There are times in life, keep breathing, nice and deep. There are times in life when we want to do forced exhalation. Those are good muscles to have. It's a good skill. But right now, we're practicing relaxation. Now the shoulder blades have started to drift much more toward the floor. The chest is open, and you're going to focus on your collarbones, your clavicles, and think about them getting longer and longer. The bones are not actually lengthening, but we can visualize the top of our chest across our clavicles widening, getting longer. And with every centimeter, every half inch that your collarbones release, your scapulae, your shoulder blades can move closer and closer to the floor, separating from the rib cage. And so here, with the palms up, the elbows to forearms resting on your mat, your butt comfortably supported, your knees bent, your feet flat, your head comfortably supported, you're going to relax. Sinking, picturing yourself melting over your prop, like candle wax dripping, like hot oil, just gently conforming to the shape of your prop, sinking toward the floor. The breath comes into the chest, the ribs widen in the front, the chest opens to the ceiling, the collarbones get wider, and relaxation is allowed to come in and occupy your whole upper body. It's completely supported by your prop. Let's make some arm circles now. Arms to the ceiling, arms overhead, bring them wide. As they come wide, you can feel the pec muscles, the chest muscles stretch. And it's just the weight of the arms that does this. There's no need to contract anything or do anything to increase the stretch, because we're going to do this a few times, and then we're going to hold in a nice stretchy position. So just the weight of the arms, gravity pulling them toward the floor, allows the pec muscles to stretch, and all of this is relieving so much postural strain and getting us out of our tendency to slump and into a lighter, floatier, yet more grounded, upright position that allows our head to comfortably settle in a position supported by the shoulders, which allows the neck to relax. Now, as your arms are coming down, find a nice stretchy position with your arms out to the side and just let them hang. Your hands might tingle a little bit in this position, and that's okay. It won't last long, just a couple minutes. See here, I am windshield wipering my arms up and down a little bit, just really distributing the great feeling of this stretch to as many fibers of my pec muscle as I can. There's no strain on the shoulders as you do this. One more time. Arms to the ceiling, arms overhead, arms to the side. Enjoy that stretch. Opening the palms and extending the wrists slightly, fingertips toward the floor. We'll bring that stretch deeper into the front lines of the arms, which I think also feels really nice. Good. Arms back at your sides, palms up. And I invite you to rest in this position for as long as you like. 5 minutes, 10 minutes, an hour. But when you do get up, roll to one side. Don't sit straight up like sitting up out of a coffin. Let your knees lead, then your hips, then roll to one side. Pull the prop out from behind you and lie flat for a minute. Give yourself some time to come back up into a seated position as I kick over my foam roller as I do this. I'm so glad you did this with me. I hope you come back and do this again tomorrow or some other one of my movement and mindfulness videos. I really enjoy sharing this with you. I hope you get as much out of it as I get putting into it. But until then, this is Dr. Russ saying thank you.